Tell me about MAKOplasty, robot-assisted surgery.
Yeah, absolutely. So MAKOplasty is one company's robotic-assisted surgery for total joint replacements. And it happens to be one of the leaders with the robotics. It first came to market about 2006. And
so it's been there a long time.
Well, it's been around a long time, but it really hasn't gotten adopted in widespread use for quite some time. And so what that allows us to do is to plan the patient's surgery completely beforehand. We get a CAT scan before the surgery.
Now, what's a CAT scan? What is it? This is a special CAT scan.
It's a special CAT scan of, let's say, the knee, in this case, the knee.
3D? Three-dimensional?
That's exactly right. 3D CAT scan that we can see on the computer and then put the implants on the computer as precisely as they can go. So we're doing the operation on the computer first. Then once that information is locked into the system, we're happy with those we know that we have the sizes the best. That information will go into the actual robotic system, the robotic arm, and at the time of surgery, I'm using a robotic arm and I'm actually doing the cuts myself, but the robot guides so that we don't stray away from that exact plan that we want to execute.
So I think what I'm hearing is everybody's knee is different.
Absolutely.
Every problem in every knee is different.
Right.
And so one side may be different on one person and the other side on the other. And so the robotic information that they're getting comes from the CT scan, tells the artificial intelligence what to do? Is that what it is?
Well, so from the CT scan, then we can design what the actual operation should look like for the patient, putting those implants right where they go. And then at the time of surgery, I tweak that a little bit as we look at the ligaments, we balance the ligaments. I can move the implant subtly so that the patient gets the best motion and we just have the best fit for that knee.